Hi, it's Anthony here. So, last night I had this idea and I thought it might be fun to change the format of my newsletter a little bit. It could become a regular newsletter in this format that I'm just having a cup of coffee while discussing maybe a health topic or some new ideas that I learned throughout the week or throughout the month or in the past many months, and see how you guys like this format. And I thought it'd just be fun as if we're having a cup of coffee together. So today's topic is actually about coffee. It is something that I spend, a good amount of time to learn this year out of curiosity, and also I'm just fascinated by how it can be a delicacy and people compete in competition in coffee. So I got really interested in it thanks to my friends in New York Coffee Project in East Village. I learned a lot from them. And then I went into, reading about coffee, the history, etc. So today I'll focus more on the health aspect of coffee, which there is a lot of, debate and, some scientists say this, some doctors say this, right? I just want to bring some perspective in this video. One of the major criticism of coffee or even association with coffee is caffeine. Caffeine has one of the major effects of caffeine is it blocks a sleep regulation receptor called adenosine. So it take place of where adenosine should be, and it blocks it. So caffeine is like, okay, this is me, you're not coming here, I'll block the receptor. But it doesn't mean that adenosine is going away. So what happened is there's going to be a buildup in adenosine in our body. So later on, when caffeine is gone, there is this buildup of adenosine, and it gets to accumulate, and we feel this like, all of a sudden we just have this crash, or this, this sleepiness that we experience. And that's what the phenomenon of caffeine crash comes from, is because of this effect. So how much caffeine is too much? And is there a better way to consume caffeinated beverage that are not as detrimental to our health and our sleep? And the answer is yes. Caffeine has a half-life of roughly 5 to 6 hours. What it means is, if this is 1 cup of coffee and has about 100 milligrams of caffeine, 5 to 6 hours later, this will become 50. 5 to 6 hours later, become 25. 5 to 6 hours later, become 12 and a half, right? So technically, we cannot even fully get all of the caffeine out of our body in 24 hours. And if you replenish your caffeine intake in the middle or later in the day, your whole body is your body is full, always having caffeine in the system. So that's something to be mindful about. If you keep it, a 1 cup in the morning, for most people that should be a tolerable amount. However, there are people with certain genes that you can run a test on that would indicate that you cannot process caffeine, and it really would interrupt your sleep more than others. And even though you can go to sleep late at night, but maybe you're not sleeping as well as you could be if you don't consume any caffeine. And usually the study says about like your deep sleep quality, it's like reduced by like 15 to 30%, depending on the person. So that's another thing to consider. Other common effect that caffeine has or coffee has on people is it creates more anxiety, and if you cannot sleep at night also, it creates a cycle of anxiety. You're already anxious and you can't sleep well, and that creates a vicious cycle, right? And you might experience heart palpitations. The other effects people might experience are coffee is a diuretic, so is tea. So you might have an urgency to go to the restroom that you cannot control, which is one of the effects on coffee on other parts of the body too. It relaxes our different vessels in a sense. So, for example, some people experience heartburn. That's because the esophageal sphincter also get too relaxed, and stomach acid is going counterflow, and we experience that feeling of heartburn. But because of that relaxation, and it is also it helps with vasodilation. So some people say they have a headache and drinking a cup of coffee that helps their pain. It's because of that reason as well. So there's helping with like blood circulation, and there is a study that shows that it helps with some asthma patients with the use of caffeine. So this is a good coffee. It's a co-ferment with honey, so it is very floral. It's not like bitter or anything. It has a sweetness in this coffee. Delicious. So the other side of the argument is coffee has a lot of health benefits. We have to understand and know that coffee is actually a cherry. And like the other cherries, coffee has high content of collagenic acid, which is an antioxidant. And the less it gets roasted, so the lighter medium coffee, which most specialty coffee are, lighter medium coffee, like this coffee tastes like tea more than the coffee that you think about. So the lighter it is, the higher the chlorogenic acid there is. So I like that. It's very high in antioxidants, and it also helps boosting metabolism. So it helps with weight loss and even fatty liver. That some studies showing. It creates, at least for me, it helps with like mental focus, and something that is I need to get certain things done in a certain amount of time. That helps me to have that urgency, because I also think that because it promotes the fight or flight response, it helps me to get things done, which for me can be helpful, and for some people, too much fight or flight might not be a good thing. So you have to use your own judgment as well. I find drinking tea, it's helped with like tasks that are a little bit more creative. So you kind of have to know who you are and how your body responds to different food. So with the mental focus, with it being a high, having a high amount of antioxidant and increases metabolism, these are some of the health benefits of coffee. There are other effects of coffee too. It has an antifungal and antiviral effect. It helps with your immune system actually. But if you are not getting enough sleep, that would negate this property. Why it has that antibacterial, antiviral property, I think it's because the plant in nature needs to release that agent to counter other pathogenic factors in the environment. So the coffee preserves that, and as the consumer of it, you are also getting that health benefits. So that is my view on why coffee has health benefits that can potentially outweigh the harmful effect of drinking coffee if you're not experiencing these harmful effects of drinking coffee. So you have to make your own decision to see if this is right for you. And it's all come back to like being mindful of your consumption and mindful of knowing who you are. Last thing I want to discuss is also when it comes to mindful consumption, the source of your food and what you consume dictates whether something is harmful or not. It's source and dosage, how much, and high quality food versus low quality food. So I would pay more attention to where your coffee comes from. Is the farm organic? And even if they don't label organic, if you speak to the coffee shop manager, they should know whether the farm practices, organic farming or biodynamic farming. A lot of the small lot farm, they actually do, but they just can't afford to label themselves as organic farm. It's a little bit more for that economic reason than they're not, organic or biodynamic farm. And second thing I want to mention related to that is storage of coffee. If you go to a grocery store, the reason why the shelf life of those coffee is so long is because they probably spray something on the beans to avoid or to prevent it being rancid or to get moldy. Naturally, coffee gets moldy and build up bacteria really quickly. So if you go to a specialty coffee, if you go to a specialty coffee store, they would probably tell you to drink your coffee about like 3 months. Like anything more than 3 months is too old. Usually like really 1 month or 2 months is maximum, and you should store it in an air seal tight container to prevent like moisture or light, or warm temperature would also damage the beans. So some people store it in the freezer. That's another way to store coffee. But I just consume and I only consume what I have in the house, and just having more fresh coffee and grind it every time I consume my coffee. So let me know what you think of this format and if you enjoy this topic. If you have any questions, feel free to ask me and I would love to answer your questions. I'll see you next time.